Good afternoon, everyone. The topic of my talk is optical percutaneous needle biopsy to differentiate liver cancer from normal parenchyma. Primary liver cancer is the sixth most diagnosed cancer and the third leading cause of cancer death worldwide. The final diagnosis verified his histological and cytological analysis of percutaneous needle biopsy (PNB) obtained with which remains a gold standard for diagnosis liver cancer. Unfortunately, due to many factors, the percentage of non-face samples reached from 10 to 20% according to various data. The use of new optical methods can help increase the efficiency of PNB. The aim of our study was to develop and to test of the possibilities of two multimodal optical biopsy setups during PNB to differentiate liver cancer from normal parenchyma. And also we present the optical needle probe of small diameter and describe all cycle of the testing from animal to clinical data of both systems. Diffuse reflectance spectroscopy allows us to determine tissue oxygenation, blood content, water content, etc. Fluorescence spectroscopy allows us to study metabolic activity during NADH and FID and morphological changes. NADH has either short or long fluorescence lifetime component depending on whether it is free and or protein bound. As the fluorescence spectra of free and protein-bound NADH are indistinguishable. Fluorescence lifetime spectroscopy allows one to separate the contributions of free and protein NADH to the total autofluorescence signal. We have developed two multimodal systems to study the metabolic condition of tissues. In this study, we used a fine needle optical probe, including emitting and collecting fibers for measurements of fluorescence intensity and diffuse reflectance. Developed technologies were tested in pilot studies and clinical studies. The pilot animal study was carried out with laboratory mice. The hybrid BDF mice with inoculated liver tumors were provided by Blakin Russia Cancer Research Center. The clinical studies were conducted during the standard biopsy procedure at the Oral Regional Clinical Hospital. First, I will present the results obtained using the multimodal fluorescence spectroscopy and diffuse reflectance spectroscopy setup. The scheme of this setup is presented on this slide. The results of animal studies are shown on this slide. Initial data analysis showed high variability of fluorescence intensities. Also, in all research in the DIS channel, we received that the oxygen saturation of tumor is higher than that of intact liver. Possible explanation is that tumors are almost exclusively vascularized by the hepatic artery, whereas healthy liver is primarily supplied by the portal vein. The results of clinical studies are shown on this slide. The liver spectra experienced a redshift in wavelength, and the peaks of the tumor's fluorescence and maximum differed from the peaks of intact liver. It can be caused by the increased presence of bile in the healthy tissue compared to the tumor. peaks wavelength and oxygen saturation were used to synthesize the decision rules presented on this slide. The lowest level of error was obtained with the combination of peak fluorescence and UV excitation and oxygen saturation, or using of all three parameters. Thereby, the combination of fluorescence spectroscopy and diffuse reflectance spectroscopy methods provides high sensitivity and specificity values. Next, I will present the results obtained using the multimodal fluorescence lifetime spectroscopy and diffuse reflectance spectroscopy setup. The fluorescence lifetime spectroscopy channel was based on the time-correlated single photon counting system. To verify that the setup reliably estimates the parameters of the fluorescence lifetime spectroscopy, we recorded the fluorescence decay curves from fresh solutions of NADH and FID. The fluorescence intensity measured in the tumors was more than 2 times higher than in the control liver tissues. However, the adjacent liver fluorescence intensity was not significantly different from that of the tumor. The obtained data emphasize the necessity of applying fluorescence decay parameters in addition to fluorescence intensities as a reliable marker to distinguish cancerous and non-cancerous liver tissue. To figure out the linear discriminant analysis parameters, the data measured in the study's animals were used. The data measured in humans were not used for the calculation of the discriminant functions, but were compared with the data measured in the murine model. The analyzed parameter of lifetime tau1 and tau2 and fluorescence intensity were used for the synthesis of the decision rules presented on this slide. The discriminant functions based on the parameters of lifetime tau1 and tau2 and ratio between alpha1 and alpha2 are shown on this slide. Calculated intensity fractions for free and bound NADH and tau2 parameter demonstrate best results to be used for the diagnostics. It is important to note that presence of tumor significantly changed metabolism and in adjacent intact liver tissue, and the use of reference data measured in healthy liver tissue can be a source of serious error when applied to distinguish the tissue of tumor and adjacent liver. Thus, the general conclusions of the study are both developed optical systems can divide the tissue into two classes, liver cancer and normal parenchyma. Despite the higher accuracy features of the fluorescence lifetime optical biopsy systems, we believe that a multimodal fluorescence spectroscopy and diffuse reflectance spectroscopy systems can be more quickly implemented in clinical practice, as it is cheaper and has high diagnostic efficiency for differentiating liver cancer from normal parenchyma. But the development of fluorescence lifetime optical biopsy systems is necessary for a detailed analysis of metabolic processes in the tumor tissues of the liver to directly identify the type of tumors in vivo in real time. We would like to thank the Russian Science Foundation and very grateful to Dr. Olga Morozova for tumor cells inoculation. Thank you for your attention.